Seniors, beware. 9 popular medications that trigger rapid dementia. Have you ever walked into a room and forgotten why you went in there? It's a simple thing, really so common that we often laugh it off. I must be getting older, we say. But what if I told you that sometimes what feels like ordinary forgetfulness isn't just age at all? What if it's something much more silent, something sitting quietly in your bathroom cabinet, taken each morning without a second thought? A few weeks ago, I sat with Mrs. Langley, a lovely woman in her early 70s. She remembered the names of every neighbor on her block, the smell of her mother's gardenia perfume, and the exact way her husband liked his coffee. But recently, she forgot the way to her daughter's house. Just like that. It rattled her. "Is this how it starts?" she whispered. The truth is, certain medications we trust, ones we've taken for years, can slowly, quietly, interfere with how our brains store and retrieve memories, and most people don't even know it's happening. In today's video, I want to walk you through this truth, gently and clearly. Let's explore 9 medications that may be affecting your memory and the simple, hopeful steps we can take together to protect your mind. Let's begin. Part 1. The allergy pill that muffled the mind. It usually starts with a sneeze, an itchy nose, maybe a restless night. So you reach for a little pink tablet, something you've trusted for years. It helps with allergies, colds, even sleep. It's over the counter. It must be safe. Right. Many seniors use first-generation antihistamines like diphenhydramine, the active ingredient in Benadryl, without ever thinking twice. They've been around for decades. But here's the part. Most people don't realize these medications don't just dry up your sinuses, they block a crucial brain chemical called acetylcholine. Acetylcholine is like a messenger in your brain. It helps brain cells talk to each other, especially in areas responsible for learning and memory. When that messenger is blocked day after day, even subtly, your mind starts to misplace pieces of the puzzle. I remember Mr. Jensen, mid-60s, former math teacher. He came in because he kept forgetting where he parked his car. Then, he couldn't recall his former students' names, the ones he used to talk about so fondly. After a few conversations and some gentle digging, we realized he'd been taking a nighttime cold medicine with diphenhydramine nearly every night for the past year. The scary part, he didn't connect the dots. Why would he? The box never said may impair your memory, but the science is strong. Long-term use of strong anticholinergic medications has been linked to increased risk of dementia. Not suddenly, but steadily, like water wearing away a stone. If you're using these medications regularly, especially for sleep, it's worth taking a closer look. Talk to your doctor. There may be safer alternatives that won't leave a quiet fog behind your eyes. Because forgetfulness isn't always aging. Sometimes it's a whisper from your brain, asking for help. Part 2. The calming pill that silences more than anxiety. It's not easy getting older. The nights feel longer, the worries louder. Sleep doesn't come as easily, and anxiety tends to linger in ways it didn't before. So when your doctor offers something to help, a small pill to calm your nerves or help you sleep, it can feel like a godsend. Benzodiazepines, often called benzos, include medications like Valium, Ativan, and Xanax. They work by enhancing the effect of a neurotransmitter called GABA, which slows down brain activity and brings a feeling of peace, of stillness. For someone struggling with anxiety or insomnia, it can feel like finally being able to breathe again. But what many people don't realize is that over time, that same stillness can extend beyond anxiety. It can touch your memory, your alertness, your very ability to connect thoughts the way you used to. I think of Mrs. Alvarez, a widow in her early 70s. She'd been prescribed Ativan after her husband passed. It helped her sleep, helped her cope. But 6 months in, she noticed she was mixing up her medication times, forgetting her doctor appointments, and struggling to follow conversations. She thought it was grief, but grief doesn't make your mind feel thick and slow. Sedation does. Studies show that long-term benzodiazepine use, especially beyond 3 months, may increase the risk of Alzheimer's disease. It's not about one pill or even 1 week. It's about the slow, quiet drift that happens when the brain, designed to be alert and active, is asked to stay calm for too long. If you or someone you love is using benzodiazepines daily or even frequently, it's time to talk. Not with fear, but with awareness. There are other ways to manage anxiety and sleep: cognitive therapy, guided relaxation, herbal supports, and shorter-term treatments that won't dull your mind along the way. You deserve rest, but you also deserve clarity. Let's work toward both, gently. Part 3. The stomach pill that starves the mind. Heartburn is no stranger in the later years. A heavy dinner, a late-night snack, a bit too much coffee, and suddenly your chest burns. Your sleep is restless, so you reach for something familiar, a proton pump inhibitor, or PPI, like omeprazole or pantoprazole. These medications are incredibly common, and they work well, perhaps a little too well. You see, while PPIs help quiet the stomach's acid production, they also reduce your body's ability to absorb key nutrients. And the brain, delicate as it is, depends on those nutrients to stay sharp and resilient. One of the most important of these is vitamin B12, essential for memory, nerve health, and clear thinking. When your body can't absorb enough B12 over time, symptoms begin to creep in, not as pain or burning, but as confusion, forgetfulness, or a fog that lingers no matter how much you rest. I remember Mr. Cho, a kind man in his late 60s. He'd been taking a PPI for over 5 years. His acid reflux was under control, but he had begun to forget appointments and confuse directions in his own neighborhood. Blood work showed low B12 levels, something we might never have checked if we hadn't connected the dots. Research has shown a link between long-term PPI use and increased risk of dementia. The connection is complex, but the message is simple: what soothes one part of your body may quietly weaken another, especially when taken long-term without review. If you're using PPIs daily for months or even years, I encourage you to ask your doctor, do I still need this? Could dietary changes help? Are there safer ways to manage reflux that won't compromise brain function? Your memory, your clarity, they're worth protecting. Even when the discomfort feels small, even when the solution seems convenient. Let's choose what nurtures both your body and your mind. Part 4. The mind-calming drug that may quiet the soul. Too much. Sometimes in life, the mind becomes restless in ways we can't always control: hallucinations, aggression, confusion. For some older adults living with dementia, schizophrenia, or bipolar disorder, this distress becomes overwhelming. That's when doctors often reach for antipsychotic medications, names like risperidone, olanzapine, or quetiapine. These are powerful medicines. They work by adjusting the brain's levels of dopamine and serotonin chemicals that regulate emotion, motivation, and cognition. When used carefully, they can calm severe agitation or erratic behavior, but like many powerful tools, they can also dull much more than they soothe. I think of Mr. Delaney, a retired mail carrier in his 70s. He had early signs of memory loss and was prescribed an antipsychotic to help with agitation. Within weeks, his wife noticed that he seemed distant, less talkative, slower. He wasn't upset anymore, but he also wasn't himself. He didn't laugh at their favorite show, didn't hum during breakfast. His brain had quieted maybe too much. These medications carry a serious warning from the FDA when used in older adults with dementia. Not only can they increase the risk of death in this group, but long-term use even in those without dementia has been associated with faster cognitive decline. That means less awareness, less independence, and a quieter fading of personality. Of course, there are cases where antipsychotics are needed, but too often they're prescribed not because someone truly needs them, but because it's hard to manage behavior changes another way. That's a tough truth, but one we must face with honesty and compassion. If you or a loved one is taking one of these medications, I encourage you to speak with your physician. Ask why it was prescribed. Ask if the benefits still outweigh the risks. There may be alternative approaches or opportunities to taper the dose, because staying calm is important. But staying present, aware, connected, that's priceless. Part 5. The sleep aid that steals more than it gives. Sleep changes as we age. It becomes lighter, more fragmented, and sometimes elusive. Many of my patients tell me, "Doc, I can fall asleep, but I can't stay asleep," or "I wake up more tired than when I went to bed." And for that reason, a quiet little pill becomes part of their nightly routine. Z drugs like zolpidem Ambien, azopiclone Lunesta, or Zaloplan Sonata. They promise rest, and in the short term, they often deliver. But sleep induced by these medications isn't the same as natural sleep. It's more like sedation. Your body is still, but your brain may not be healing the way it should. During normal sleep, the brain cycles through stages, especially deep sleep and REM, where memories are organized. Emotional stress is processed, and the brain resets itself. Z drugs disrupt that rhythm. You might be unconscious for 8 hours, but your mind hasn't truly rested. Over time, that can add up. I remember Mrs. Holloway, a gentle woman in her 70s who had started forgetting names, confusing her schedule, and often felt groggy in the morning. She thought it was poor sleep. But in truth, her sleep aid was interfering with the very thing she needed: restorative rest. Studies have linked long-term use of Z drugs in seniors with a significantly higher risk of dementia, as well as falls, confusion, and even nighttime wandering. These effects can be subtle: feeling slower in conversation, forgetting where you placed your glasses, but they speak volumes if we listen. This doesn't mean you must suffer through sleepless nights. It means there are gentler ways to reclaim rest: consistent routines, dimming lights an hour before bed, using calming teas like chamomile, even gentle stretching. And yes, sometimes temporary medication support is needed, but not forever. So if you find yourself leaning on sleep aids night after night, pause and reflect. Ask, is this the sleep my body and brain truly need? Because rest should heal you, not steal from you. Part 6. The antidepressant that numbs more than sadness. Depression is not uncommon in our later years. Sometimes it's subtle, like a quiet loss of joy, or the feeling that colors are just a little more faded than they used to be. And sometimes it's deep, heavy, and tied to real pain: the loss of a spouse, declining health, isolation. In those moments, a prescription for an antidepressant can feel like a lifeline. But not all antidepressants are created equal, especially for aging brains. Tricyclic antidepressants, like amitriptyline or doxepin, are older medications that were once widely used. They do have the power to lift mood, but they also come with something far more dangerous for seniors: strong anticholinergic effects. That means they block acetylcholine, the same crucial brain chemical we've been talking about, the one tied to memory, focus, and mental clarity. I remember Mr. Callahan, a retired librarian who came to me after 6 months of being on a tricyclic. He felt more sluggish, had trouble concentrating, and had even fallen asleep mid-conversation. "I thought the sadness was lifting," he said, "but now it's like my whole mind is wrapped in wool." The science supports his story. Studies show that the longer these medications are used and the higher the dose, the greater the risk of cognitive decline. What starts as a medication for sadness may quietly become a barrier between you and the world around you. Now, that doesn't mean we should dismiss depression in seniors. Far from it. Your emotional well-being matters deeply. But there are newer antidepressants, with fewer cognitive side effects, that may offer light without dimming your clarity. If you or someone you love is on one of these older antidepressants and experiencing confusion, fatigue, or memory changes, don't just assume it's part of aging or the depression itself. It could very well be the medication. Let's bring that into the conversation. Because you deserve to feel better not just in mood, but in mind. Both can be cared for, with gentleness and wisdom. Part 7. The Bladder Pill that quietly shrinks the brain. Some of the most frustrating changes with age are the ones we rarely talk about, like having to rush to the bathroom, waking up multiple times a night to urinate, or the constant fear of accidents in public. These bladder symptoms are deeply personal, often embarrassing. So, when a doctor offers relief, usually in the form of medications like oxybutynin, tolterodine, or sulfonacin, it feels like a blessing. But there's something about these medications that many people never hear. They belong to a group of anticholinergic drugs, the very type that interferes with acetylcholine, the brain's messenger for memory and thinking. These medications calm the overactive bladder by dulling signals between nerves, but they don't stop at the bladder, they reach the brain too. And for some seniors, this can mean more than just a slower stream of urine. It can mean a slower stream of thoughts. I think of Mrs. Evans, a soft-spoken woman in her late 60s. After months on bladder medication, she told me she no longer felt like herself. "It's like my mind takes longer to turn on in the morning," she said. Her daughter noticed she struggled to manage her calendar and often repeated herself in conversations. Brain imaging studies have shown that long-term use of bladder anticholinergics can actually reduce brain volume in areas critical for memory. Not only that, but test scores on memory and attention tasks also decline. Of course, bladder issues are real and quality of life matters. But what if there are alternatives? Sometimes pelvic floor exercises, changes in fluid timing, or even safer non-anticholinergic medications can help. It all begins with awareness and conversation. So if you've been on one of these medications and you're feeling less mentally sharp, it's not just in your head. Your brain may be quietly asking for a different path, because your dignity, both in body and in mind, deserves full protection. Part 8. The Heart Pill that may weaken the mind. For decades, we've been told that lowering cholesterol is essential to protecting the heart, and in many ways, that's true. Statin medications like atorvastatin, simvastatin, and rosuvastatin have saved lives by reducing the risk of heart attacks and strokes. For millions, they're a daily ritual, taken with trust and habit. But here's a lesser-known truth: your brain needs cholesterol too. Roughly 25% of the body's total cholesterol is found in the brain. It's used to build the myelin sheath that protects nerve fibers, to form cell membranes, and to help create essential neurotransmitters like dopamine and serotonin. In short, cholesterol is a crucial ingredient in how your brain functions, feels, and remembers. When cholesterol is reduced too aggressively, especially in older adults, it may begin to affect mental sharpness. I once worked with Mr. Green, a quiet gentleman in his 70s. After increasing his statin dose, his wife noticed he was more withdrawn, forgetful, and struggled to follow conversations. "He's just not as quick as he used to be," she said. Some studies have shown a link between statin use and memory problems, particularly when doses are high or when used long-term. In fact, many patients report a noticeable improvement in clarity after adjusting or discontinuing the drug, of course, always under medical supervision. Now, let's be clear. Statins save lives. They are not bad medications, but what's important is balance. If you're experiencing brain fog, confusion, or memory slips and you're taking a statin, don't ignore it. Bring it up with your doctor. Ask if your cholesterol is being managed too aggressively. Ask whether your current dose is still necessary, or whether a different medication might suit you better, because your heart and your mind should be allies, not opponents. And the goal of any treatment should be to preserve the whole of who you are, not just a number on a chart. Part 9. The silent combination that clouds the mind. It's easy to think that danger only lies in the big medications, the ones with complex names or black box warnings. But sometimes, the greatest threat to memory comes not from a single pill, but from the quiet accumulation of many small ones. Combination medications, especially those that contain multiple anticholinergic ingredients, are among the most concerning for cognitive health in older adults. These include over-the-counter cold remedies, motion sickness patches, muscle relaxants, and even nighttime pain relievers. You may not even realize they belong to the same class, but together, they add up. Each anticholinergic drug blocks a portion of acetylcholine. One pill might cause a little drowsiness. Two might bring a bit of forgetfulness. But over time, especially when taken daily, these medications can quietly chip away at your brain's ability to think, remember, and stay present. I once cared for a retired nurse, Mrs. Taylor, who came in complaining of persistent brain fog. She was taking a muscle relaxer for her back, a nighttime cold medicine, and a patch for motion sickness on long car rides, separately. They seemed harmless. Together, they were acting like a slow drip of forgetfulness. A long-term study of over 3,000 older adults found that those with the highest cumulative use of anticholinergic drugs had a 54% higher risk of developing dementia even if they had stopped taking the medications years earlier. The effects weren't immediate. They were slow, silent, and often invisible until it was too late. That's why this topic matters. Not to cause fear, but to shine a light. If you're taking multiple medications prescribed or over-the-counter, it's time to sit down and truly inventory them. Look at the labels. Ask your pharmacist. Talk to your doctor. You might be surprised to discover just how many of your pills quietly fall into this category. The goal isn't to stop every medication, but to be informed, to consider whether the benefits are still worth the risk, and to remember your brain is precious. Every clear thought, every memory, every conversation, it matters. Let's not let a handful of pills, taken with good intention, silently erase the most beautiful parts of who you are. When we think of memory loss, we often assume it's just part of aging, a natural slipping of time, like autumn leaves drifting from the tree. But what we've explored today tells a deeper, more delicate truth sometimes. What looks like aging is something else entirely. Sometimes it's a quiet response to the medications we've taken in trust, day after day, year after year. This isn't about blame, it's about awareness. Because when we understand how our body and our brain responds to what we put in it, we gain the power to protect it. Whether it's an allergy pill, a sleep aid, or a bladder medication, whether you've taken it for 5 months or 15 years, it's never too late to ask questions, to review, to speak with your doctor not just about numbers and test results, but about how you feel, how clearly you think, how vividly you remember your life. And it's never too late to begin again through foods that nourish the brain, like blueberries, salmon, leafy greens, through gentle routines that support restful sleep, movement, and joy. Your mind holds stories, names, laughter, and the quiet wisdom of decades. It deserves to be guarded, honored, and preserved. So if this video brought to mind a loved one, or if you saw a little of yourself in these stories, I invite you to take a small but meaningful step. Talk with your doctor. Rethink your medicine cabinet. Share this message with someone who may need it, because memory matters, and so do you. Thank you for spending this time with me. If you found this helpful, I'd be honored if you'd leave a comment or share your experience below. Let's keep this conversation going for each other and for the minds we love.